Hello everyone, let's get started on our next topic, that is timing of intervention in children with patent ductus arteriosus. This topic also I've taken it from Ijpp 2025 article. Yes, right. So the clinical manifestation of a child with PDA, it depends on the size of their PDA. So it mainly depends on the size of the ductus or size of the defect. Right? Yes. So depending upon that clinical manifestation or depending upon the size of the ductus the child has, we have classified into large, moderate, small and silent PDA. So what are the symptoms the child can have in the child is having a large PDA? So the child will have symptoms of your congestive cardiac failure. The child will have symptoms of congestive heart failure. Right? Yes. The murmur. The children with large PDA will have a soft or a faint systolic murmur, or there won't be any continuous. There won't be any continuous murmur. Right? Yes. What will be their echo finding? They will have evidence of a left ventricular overload. So left ventricular overload will be present. Along with this, the child will have a severe pulmonary arterial hypertension. Okay, these are their echo findings. Next, in child with a moderate PDA, child will have no or mild symptoms will be present. Okay, the murmur, the child will have a continuous murmur on auscultation. Echo findings, the child will show a mild left ventricular overload. So there will be a mild left ventricular overload will be present. There will be a mild to moderate PAH. This is for the child with moderate PDA. In child with a small PDA, the child will be asymptomatic. There won't be any murmur. The child will have a the child will have a continuous or only a systolic murmur will be present. Okay. The child will have a continuous or only systolic murmur will be present. And on echo findings, there won't be any left ventricular overload or there won't be any pulmonary arterial hypertension. So there is no left ventricular overload and there is no PH. Right? This is for child with small PDA. So only finding here will be the child will have a continuous murmur or only a systolic murmur will be present. Well, coming to your silent PDA, here also child will be asymptomatic. There won't be any murmur. Only you can find is your echo finding. Only during your echo finding the PDA will be seen only in your echo. This is for child with a silent PDA. So what are the conditions or at what time are you going to intervene in a child with a PDA? So the clinical course and the management for a child with PDA depends between whether the child is a term child or a preterm child. In a term neonate, there will be a spontaneous closure of your small PDA by around 3 months of age. So spontaneous closure you can expect for a term child with a small PDA. It can occur up to 3 months of age. Yes. At what are the time period you have to intervene in a term child with a large PDA? So for large PDA it is by 3 months of age. And for moderate PDA it is between 6 months to 1 year of age. And child with for small PDA, it is between 12 to 18 months of age you are going to intervene. For a child with a silent PDA, closure is not required. Okay. This is the timing of intervention in a child with this PDA, right? Yes. Mode of closure. So how do you intervene in a child with this a large, moderate, small and this PDA? So when the child's weight is less than 6 kg, then you will be going for surgical ligation. So child's weight is less than 6 kg, you go for surgical ligation, which is a treatment of choice. If the child weight is more than 6 kg, then we will go for a device closure is your procedure of choice. Right? This is for a term child, the timing of intervention and the mode of closure. Next, going on to your preterm child. So preterm child, what are the indications for closure in a preterm child? When the child is having a symptomatic and a hemodynamically significant PDA, then you go for a intervention in a preterm child. So intervention is required only when the child is having a symptoms. That is, the child is a symptomatic neonate with hemodynamically significant PDA, then you go for a closure in a child, in a preterm child. So what are the methods you have in a preterm child for closure? One is your medical therapy, another one is your surgical and your device closure. So coming to your medical therapy, what are the drugs? So drugs are your paracetamol, brufen and your indomethacin are available for your medical therapy for closure of PDA in your preterm child. So what are the doses of your paracetamol? It is your 15 mg per kg per dose. Every 6th hourly you should give for around 3 to 7 days. It can be given as oral or either it can be your IV. Route of administration can be oral or can be IV. Dose is 15 mg per kg per dose, 6th hourly for 3 to 7 days. Then in case of brufen, the dose is 10 mg per kg per day on day 1, and it will be followed by 5 mg per kg per day on your day 2 and day 3 at 24-hour intervals apart. Route of administration is oral or it can be IV route. Next, coming to indomethacin, your dose will be 0.2 mg per kg 12th hourly. Right? For you should give around maximum 3 doses. Okay, this is regarding your indomethacin. It is 0.2 mg per kg 12th hourly, 3 doses. Right? Yes. Next, a second course of, so that this is your first course of drugs. A second course of this drug therapy can be repeated after 48 hours if the duct remains patent. So if the duct remain patent, then you can repeat a second course. So then you can repeat a second course of your drug therapy after 48 hours. Right? Yes. Even after repeating these 2 courses, if the duct remains open or if the infant remains symptomatic, then you will be going for a surgical ligation. That is, when will you go for a surgical ligation? If they ask, when will you go for a surgical ligation in a preterm child with a PDA? That is, after repeating at least 2 courses of your medical therapy and the child is symptomatic. If the child or infant remains symptomatic, then you go for a surgical ligation. Yes. Device closure is, the FDA has recently approved a device closure. The name is Amplessor Piccolo device for PDA closure in preterm babies who are weighing more than 700 grams. So the FDA approved is your Amplessor Piccolo device as a device closure for a PDA in a preterm child who are weighing above more than 700 grams. Okay, this is a very short topic that is for timing of intervention in a child with your patent ductus arteriosus. Thank you for your patience listening. Kindly suggest other videos which we need to put in our YouTube channel, and whichever you like also. Thank you so much. Let's all learn pediatric together.